Hi, YouTube. This is D Sensation. I am back with another update on my surgical recovery from my abdominal hysterectomy. So it's been approximately a little over 5 weeks. No, I'm going to say 6 weeks since I began vlogging my recovery. So I wanted to just give you an update on how I'm feeling, what's going on with me. And my last video, I talked about endometriosis and what it was exactly, which was one of the reasons why my doctors and I decided on having the total abdominal hysterectomy with the removal of my cervix and the fallopian tubes as well. So my ovaries were left in, and this is where I'm at right now, as of today, as of right now. And also give you an update on what my next steps are going to be. Now, in some videos before this, a few videos before this, if I'm not mistaken, I spoke about going to the doctor, getting my results from the pathology report from my surgical pathology report. I never got the report as of yet. It still is not back to my doctor's office from the hospital. And this is something that I have been working on to try and get the results, make sure that I don't have any precancerous cells, and just making sure that they didn't find anything that I don't know about. And if they do, what's my next move on trying to eliminate that or treat it if it needs to be. I wanted to go over some of the medications that my doctor stated he wanted to put me on prior to me getting my total abdominal hysterectomy. One of the medicines was Depo-Lupron, and it's a shot that you can get. You can look it up. And what it does, it's supposed to help with the pain that comes with having endometriosis in the pelvic area. So I was not approved for the shot. So this was moving me another step forward to getting my total abdominal hysterectomy in the first place. I was not approved for it. My insurance did not cover it. Also, my doctor wanted to give me an ablation. And ablation is where they burn or freeze the lining of your uterus so that there will be no more bleeding, which may help with the heavy bleeding and help somewhat with your endometriosis. For some women, it works. And for me, this was not an option because of the severity of my endometriosis. I was not a candidate. And also, I had 3 C-sections, prior to, I had 3 C-sections. So this took me out of the category for having an ablation from what my doctors told me. I was not a candidate for that specific surgery, which had, it was minimally invasive. So we ended up with the total abdominal hysterectomy. I'm still on the road to recovery. What's going on with me now, and like I said in other videos, is night sweats. These night sweats, night sweats and day sweats. I'm sweating and then I'm cold and then I'm sweating again and then I'm cold again. So this is just a back and forth thing that's been going on. And my doctor said that I may be put on hormones. As of yet, I have not been put on hormones yet. But if I am put on hormones or placed on hormones from my doctor, I'll let you know what kind they put me on and the exact reason why he stated that he's going to prescribe these for me. Also, the going to the bathroom has been a task for me. has been painful as far as urinating. And if this is something that you don't want to hear, you can stop the video, fast forward it, or do whatever you need to do. But it's a little bit graphic. So if you're not over 18, then I suggest you not listen to what I'm saying. But for those of you that are, here it is. When I use the bathroom, there's a lot of pain in where I thought where my uterus used to be at, to me, which I guess is in my bladder. There's a lot of pain when I use the bathroom, when I'm urinating, which is something that I'm not happy with. And that's something that my doctors are looking into now. They don't see any infection. So we're trying to find out why I'm having so much pain. Is it just because of the surgery, or is it something else? So they're running tests to see what it is. So like I said, sleeping on my side, I've been sleeping on my back since I left the hospital, since I was in the hospital after my surgery. Sleeping on my back is killing me. It's very painful now, and because I have a lung disease, sarcoidosis, and COPD, and lupus, it's very hard for me to continuously sleep on my back. So my joints, my back is very inflamed with pain and inflammation, and I want to move, but it's hard for me to do so because of the tenderness and pain that I still continuously have in my pelvic area where my incision is and where the removal of my uterus was done. So I've been trying to put pillows under my side on which I lay on so I don't have too much pulling, but it's not really doing too great of a job. So I'm still forced now to sleep on my back, which I'm not happy with. So I'm not really getting enough sleep. I'm really fatigued and tired. Again, a lot of depression I'm going through, with second guessing on whether or not I should have had this surgery, because I still am in a great deal of pain. Something where I thought at this particular time after my surgery, I would be feeling much better than I am, and I'm not. I have, what else? I have good days where I'm able to definitely walk around much better. I'm able to walk around much better. Um, I'm able to take care of myself and get dressed a little bit better. I still need help to put on socks and shoes if need be. I still need help with that. And I still need help with my showering as far as cleaning my feet and anything below my knees and my back. So that is a situation that I can't wait to come out of, because I like to be more independent in the things that I do on a day-to-day basis. I have, what else? There's some things going on with cramping where I feel like it's menstrual cramps, and this is what I'm feeling. There's a lot of pain and menstrual cramping pains that I'm feeling that I don't know if I should be having. Now, I do know that with endometriosis, even though you have received a total abdominal hysterectomy, you can still, or it may not always alleviate all of the pain from endometriosis. You may still have pelvic pain after your hysterectomy. This is something that if you're thinking about getting your hysterectomy, or if you have a hysterectomy or you're going to have one, you need to speak about this with your doctor ASAP, because I'm continuously having terrible cramping and pain and pressure, especially standing and sitting. It's very difficult for me to do so without feeling discomfort. Again, I don't know if I'm giving myself enough time, but I thought I would be feeling a lot better than what I'm feeling, as I said before. So the pain, the cramping, other than that, my recovery has been has a toll on me. My eating is a little bit better. I do get full a lot quicker, and I'm not really having a big appetite. I mostly eat because I have medications that I need to take, and I want to make sure that I get those medications in me. So I eat. And I have to eat to survive. You have to eat to heal. So I eat, I drink lots of water, and I continuously pray and just hope for a better day every day. Now, every day, I'm not saying that it is worse than the day before, but some days are worse than others. There's some days where I thought that I was feeling better, and then it's like I do a relapse and I go back into the same cramping, pressures, and pain. Now, I was reading that if you still have your ovaries, which I have my ovaries, your ovaries will still give out hormones which will make your body feel as though you're going to have a menstrual cycle. You will have tenderness in your breasts. You can have menstrual cramping and all of the things associated with having a menstrual cycle. So this is something else that I really didn't know, or I was hoping, because it does not happen to all women, but it seems like I'm one of the women where this is happening too. So this is definitely something that I'm not happy about. So far, the good thing is that the issue with my bleeding, of course, because I'm not having a menstrual cycle due to the fact that they removed the doctors removed my uterus. So the menstrual bleeding is gone. So my blood has been checked to make sure that my levels are going up and that I'm not bleeding anywhere else in my body, which will cause me to continuously be as anemic as I was prior to my surgery. So I'm hoping with that point, at least I will have a good outcome with that, with my anemia, and I won't have to have any more blood transfusions and any more iron infusions. So I hope you guys pray for me on that, and just hope that at least that part of it is a go and was a good choice to make. But as far as anything else, my scar isn't too bad. It seems to be healing good. It's very tender. It's very sore. And if you're going to be having this operation, my advice is to make sure you have some stretchy, comfortable clothes to wear, so that way it does not rub against your incision if you're having an abdominal hysterectomy. In my case, I don't want anything to rub against my incision. Even the towel, even the stretchies that I do wear, the leggings that I wear, I still pull them up high enough so that they do not rub against my incision. And I do keep something covered over my incision so that way nothing rubs on it, because the pain is tremendous. So this is where I'm at in my recovery stages with or the aftermath of my surgery. For women that are or were in the position that I was in prior to having this, just make sure that you ask a lot of questions with your doctor, and you sit down with your gynecologist and really sit down and speak to them about all of your options before you have this hysterectomy. And I'm not saying don't have it, and I'm not saying do have it. I'm just saying make sure that it's the right choice for you. Because for me, I'm 50-50 on the fence both ways. Maybe I shouldn't have, maybe I should have. So I'm having a lot of pain, but I do notice that I am healing, but I want my energy back. My energy is very low. I'm very fatigued. I can sleep and sleep and sleep. My appetite is not as good as it should be, and I'm taking a lot of pain medicines to help relieve some of the pain and the pressure that I feel in my pelvic area. So this is where I'm at with my post-op 6-week total abdominal hysterectomy surgery. This is my update for you guys. And I definitely want you to hit the like button. If you're coming in, if you're going out of this video, just hit the like button. Leave any comments that you think you want to ask me, or any comments that you think may help me. Also, if you would like, you can subscribe to my channel, or you could leave information about your channel if you feel like it's something that can help me with my endometriosis. I'm going to have a few more videos on endometriosis, and then I'm definitely going to lead up into my my fight with sarcoidosis, the different medications that I take while I'm fighting sarcoidosis and lupus and anemia and COPD. So I will be updating you with much more videos to come. I thank you for I thank you for everything. I thank you for coming to my channel, listening to the things that I have to say. And like I said, please give me some comments, if you will, on some things that may help me, or some things that I don't know about, because I really want to learn about endometriosis and all the other diseases that I discussed. It's been a real rough journey for me, and I'm really hoping that I can get to a place where I come on here and let you know, yay, I'm feeling 100% better. I haven't gotten to that point yet, but I'm definitely praying every day that I get there. So this is my update. Thank you for listening, and God bless you all. I hope you stay safe. All of those that are having bad weather and a lot of snow, stay safe. Like my husband, who was out there, who's out in the bad weather. You stay safe. Everybody stay safe and stay warm, and just be well. And that's it. Later.